Given the global COVID-19 pandemic, healthcare officials are under intense psychological pressure. Supporting the mental health of these individuals is an important part of the public health response. This presentation uses a study of the mental health of medical staff in Wuhan, China, to suggest possible responses to support the mental health of frontline workers in the wake of COVID-19. The study, Impact on Mental Health and Perceptions of Psychological Care Among Medical and Nursing Staff in Wuhan During the 2019 Novel Coronavirus Disease Outbreak, a cross-sectional study, was the first paper on the mental health of medical and nursing staff in Wuhan. The study evaluates the mental health status of medical and nursing staff in Wuhan during the outbreak, the efficacy of the psychological care accessed, and their psychological care needs. It was done in the immediate wake of the COVID-19 outbreak, partly to determine which psychological services are needed during this crisis. At the time the article was written, mental health workers in Wuhan were already establishing psychological intervention teams and providing a range of psychological services, including psychological brochures, counseling, and psychotherapy to reduce the psychological damage of COVID-19 among medical and nursing staff. In addition, television news and online media also disseminated information about coping strategies for psychological self-help. In March 2020, the WHO Department of Mental Health and Substance Use actually released a document designed to support mental and psychosocial well-being in different target groups during the outbreak. While this document was released after the study, I feel that it is an important resource to mention, and I will be including a link to it in my references slide. Of all 994 participants in the study, 36.3% had received psychological materials such as the brochures I mentioned. 50.4% had used psychological resources available through media, and 17.5% had participated in group psychological counseling. Among the 994 medical and nursing staff, 36.9% reported subclinical mental health disturbances. 34.4% had mild disturbances, 22.4% had moderate disturbances, and 6.2% had severe disturbances in the immediate wake of COVID-19. When asked about which mental health care services they wanted to receive, the answers of medical and nursing staff varied depending on their levels of mental health problems. Medical and nursing staff with subclinical and mild disturbances preferred to obtain such services from media sources. Meanwhile, those with moderate disturbances were also interested in individual counseling or psychotherapy, and the staff with severe disturbances preferred to seek help directly from professionals through individual counseling or psychotherapy, as well as group psychotherapy. These results demonstrate that a large portion of healthcare providers in Wuhan suffered from mental health disturbances as a result of the initial COVID-19 epidemic. Medical and nursing staff affected by the crisis could benefit from greater availability of personalized mental health care from psychotherapists and psychiatrists, with a focus on providing specialized mental health care services depending on mental health status. The data presented shows that psychological advice and guidance in print resources and disseminated in the media can provide a certain level of protection for medical and nursing staff, improving mental health by reducing the stress impacts caused by the COVID-19 epidemic. Therapist-driven sessions such as group psychotherapy, as well as individual counseling or psychotherapy, could greatly benefit those with heavier burdens. In addition, the study found that people with subclinical and mild mental health disturbances wanted to find ways to better help others, which is very beneficial for the overall team environment. Medical and nursing staff on the front lines of a crisis are pivotal to the overall response, and care for these caregivers, whether by providing tools for self-help or professional psychological guidance, is crucial in efforts to extend their efficiency and to maintain their mental health in the long term. Thank you for listening to my presentation, and I hope it was helpful for you.